Deputy President, good afternoon to you, and thank you so much for your time this afternoon. Let me just start with a question about women. The COVID-19 pandemic, the lockdowns here and around the world, do you believe that they may be having a disproportionate impact on women? They could be suffering more than men as a result of all of this?
I didn't hear the question, but if you're asking if men are more affected, more men are dying, that's for sure. But women are suffering a lot of the collateral effects of this pandemic, particularly when it comes to gender-based violence, where we've seen an upsurge of up to 30% in most countries, including South Africa, Kenya, Singapore, Argentina, France. The reports are just endless.
What seems to be causing this? Is this just because women can't escape the men that they're sort of locked down with? In other words, in many situations, a woman's able to escape from the situation. During a lockdown, she can't.
Yes, exactly. A lockdown in this situation for women is being locked in with your abuser with very little possibility to escape. We are asking governments around the world to declare the services that are being provided to women who are affected by abuse essential services in order to make sure that they can reach these services easily. We are pushing all countries to have hotlines at this point because this is how we identify where the abusers are. We're also asking countries to make sure that the courts are open, that they support civil society who are providing services such as shelters, and that the government departments that provide services to these women must be supported very strongly at this point.
Do you believe that South Africa's government is doing enough in this area? We have certain hotlines that have been set up. We have people manning them. We have ministers talking about this on an almost daily basis. Do you believe our government is doing enough to help women in this situation?
Personally, let me just say that GBV is a shadow pandemic. It was there before COVID-19. It is now in the increase, and it will be there after COVID. So we've been expecting government to be continuing with the work that they were doing. There's always more to do, and South Africa can also do more. I don't know, I cannot confirm whether they are doing worse or better at this point in time because it's difficult to coordinate information, but there are services that are being provided. I have myself participated in the planning of the activities as well as the decisions that were being made in order to allocate more resources to service providers.
We're seeing around the world that the role of government has simply increased. I mean, some people try to avoid government. Now we've found how important governance is in the time of COVID-19. Do you think governments around the world actually have the resources to deal with this pandemic? It's affected everybody.
Well, very few governments have got the fiscal space to address the pandemic at the extent that it needs to be addressed. But we are seeing that even poor countries are managing to scrap resources and make them available. We are seeing private sector philanthropists, people being generous and responding. We are, for instance, pushing that in the stimulus that are being provided to businesses, there must be a particular window to support in the informal sector because most women are in the informal sector. We are also pushing that when it comes into social protection, it is targeted to women, especially if it is a cash transfer. Women need food at this point. We also get calls in the call centers, in the hotlines and call centers, that are not just complaining about violence, but people are actually reporting that they are hungry. So this issue of food is actually quite important because some of the people who find it difficult to stay at home, it is because they need to go out and look for food. So we need a coordinated response to address the issue of hunger.
I mean, many people see this as a sort of binary choice. You either protect people from the virus and you have a lockdown, or you have an economy, but you can't have both. Obviously, life is a lot more complicated than that. We need all sorts of measures to protect economies here and around the world.
Yes, definitely. These are difficult choices. Just as women are not just helpless victims, they are standing up, they are trying to fight for themselves, but also they are the ones that are carrying the response as health workers, because 70% of the health workers are actually women. They are at the forefront of the people who are being infected. I appreciate that, for instance, in Kenya, the government has decided that health workers will be given an allowance in order to enable them to have more money to buy food, to have people, pay people who will help them to look after children, because they still carry the burden of care. They work in the hospital, they go home, they are still primary caregivers at home as well.
It's a very difficult situation. The United Nations has become obviously the organization to deal with all of this. The World Health Organization is the lead agency. There have been some unpleasant developments around that. Are you worried some political leaders are trying to politicize the work of the World Health Organization, the United Nations, during all of this time? I mean, that is going to have an impact on all of the United Nations agencies in what's really an international emergency.
Yes, we are staying out of politics at this point. We think that this is time to unite and to use all resources from all countries and to be in solidarity with each other. No time to politicize the issue.
Is the issue of women being given enough importance? I mean, everyone talks about COVID-19 everywhere, and they talk about it all the time. Do you believe that there's enough of a focus on the plight that women are facing? Do we need to talk about that more?
Yes, and that is why we are saying that it has to be declared an essential service, so that when governments do their daily briefings to their citizens, they actually have time to address this issue. And this should not be done by civil society only. It has to be a priority for government, and they must be the ones to pronounce on the policies and the services that are being provided.
The head of the World Health Organization, Dr. Tedros Ghebreyesus, he actually received death threats, racist death threats, it seems, during this time. I would imagine you join everyone in condemning that kind of thing, the idea that the head of the World Health Organization can face a racist threat.
Absolutely. We have really been distressed by this, and we have done everything we can to support both the director of WHO as well as the staff. They are doing an exceptional job under very difficult circumstances, and they can use all our supports.
And in China, I don't know if you will say anything to this, Madam Deputy President. I accept what you say about wanting to stay out of politics, but there are reports that people from Africa who are living in China are being forced to leave certain areas, that they're being discriminated against. Does that worry you? I mean, discrimination is probably the last thing anyone needs during this time.
This is absolutely worrying, and I'm glad that the African Union is looking into it. Our president is looking into it, and the African Union in Ethiopia, in Addis, is also looking into this.
And Madam Deputy President, I realize you have to go, and it's not a great line from your end. You're not able to hear me clearly. Are you convinced that as humanity, as human beings, we will beat COVID-19?
Yes, I am convinced we will beat COVID-19, but we actually have to do our part. We have to stay at home. We have to wash hands. We have to make sure that we stay at home because our health workers are going to work for us. We must not complicate this problem. It's already too complex and too difficult.
Ma'am, I appreciate the time. I appreciate you battling through not being able to hear me clearly. Thank you very much indeed. That is our former Deputy President of South Africa. She's now the United Nations Executive Director for Women, Phumzile Mlambo-Ngcuka.